This is pharmaphorum web editor Nicole Raleigh. Today I'll be speaking with Professor Thomas Forst, who is Chief Medical Officer at hVIVO, about the company's work in the cardiometabolic space generally, and more specifically about GLP-1 receptor agonists, about their popularity, their potential, but also the role that a more holistic approach can offer too. All fat, after all, is not equal. hVIVO is a full-service early-phase contract research organisation, or CRO, offering end-to-end drug development services from preclinical consultancy through to phase 3 clinical trials. It is actively involved in obesity research, particularly in the context of GLP-1 receptor agonists and their impact on obesity care. To begin with, though, Thomas, perhaps you could describe the landscape of unmet need when it comes to the obesity field.
Yes, thank you very much. So obesity, we learned that is much more than just an increase in body weight. It's a real dangerous disease. It's a very malignant disease. It is associated with a lot of comorbidities like diabetes, like heart failure, like cardiovascular disease, but also some kind of cancers. And so there is a very, very high need to find better solutions and to find better treatments for patients which suffer from overweight or which suffer from obesity. And this is something we are very much involved during the last 10 years. And there is nice developments in these new drugs, in these new medications, which offer us a great chance not only to treat obesity, but to have a more effective way to address this kind of comorbidities, which often lead to really big burdens for the patients or even an increased mortality and morbidity.
Thank you, Thomas. Now, hVIVO's research has highlighted the potential of GLP-1 receptor agonists to improve weight loss, metabolic health, and reduce cardiovascular risks. So I was wondering if you could also speak briefly to that.
Yes. So it started, let's say, a decade ago with the GLP-1 receptor agonists, which were first developed for the treatment of type 2 diabetes. But then it came out that it also had very nice effects on body weight. You see, most of the type 2 diabetic patients are overweight or obese, and it was found that they were able to reduce their body weight. And later on, these GLP-1 receptor agonists, or let's say some of the GLP-1 receptor agonists, have been also approved for the treatment of obesity beyond type 2 diabetes. And we have now lots of studies in place which were able to show that GLP-1 receptor agonists are able to reduce the cardiovascular morbidity and mortality in patients with type 2 diabetes, but also in patients with obesity without type 2 diabetes. But they have also been shown to be beneficial in heart failure disease and in renal disease, in sleep apnea, and much other complications of obesity.
Thank you. I want to sort of shift to a more general question now within the obesity field. And that question is, it might be controversial, but weight loss, is that actually the most important factor in obesity, Thomas?
Yeah, you see, of course, we measure weight loss and we measure changes in the body mass index. But that what is driving the comorbidities is something else. So it's not weight or it's not body mass index, it's a fat distribution, and it's a lot of change in adipose tissue biology. So it's not just getting more adipose tissue, it's fat on wrong places. We call that ectopic fat, which means fat is stored at places where it should not be stored, like the liver, but also the heart or the pancreas or even muscles, where you have an increased fat content. And this fat tissue in the wrong places has a different behavior. It's ill. It has a high amount of inflammation. There are a lot of adipokines which are secreted from this ectopic fat, and these are the drivers of these comorbidities which I already mentioned. So even the measurement of body weight or BMI is not really reflecting this risk. It would be much better if we choose something else, like the waist or the waist-hip ratio or the waist circumference, which much better reflects the ectopic fat and which much better reflects the cardiovascular risk of these patients.
Thank you. So it can be said then that GLP-1s are not a panacea for obesity.
No, they are much more. They are much more. They are a treatment of this metabolic disease, which is driven by obesity, and it's therefore beneficial for all of these comorbidities, like cardiovascular morbidity and mortality, but also for different cancers and heart failure and a lot of other things. So it's much more, and it's not only GLP-1s. So it started with GLP-1s. We have now more of these peptides. We call them incretins, and this is, for example, also GIP, another peptide which is produced in the gastrointestinal tract, which we use for the treatment of type 2 diabetes and obesity. And there are lots of others. So it started with the GLP-1 receptor agonists, but we are now developing more and more peptides, drugs, dual agonists, triple agonists, oral small molecules, which offer us a lot of more opportunities to treat this obesity association complications or even the morbidity and mortality.
Well, the complexity of treating obesity is clear. So I was wondering if you had any final thoughts that you'd like our viewers to consider regarding our discussion today, Thomas.
Yeah, you see, for me, there's one point which still is very, very important. There are a lot of new opportunities which allow us to more effectively address the issues. But we should not forget that lifestyle modification, that modification of the diet, increasing physical activity, is still a part of the treatment of overweight and obesity. And even with these new drugs in place and in the future having more and other drugs in addition to GLP-1 receptor agonists, it's still even more important that people increase their physical activity and take care for their nutrition. You see, when you lose weight with this kind of drugs, you do not lose only adipose tissue, you also lose muscle tissue. And we try to avoid that, or it's our guess, we want to avoid that. And therefore we need lifestyle modifications and diet instructions which help us to do that. That's very, very important. We should not forget that in the face of all these new opportunities.
Thank you, Thomas. If Professor Forst's insights have piqued your interest, please do register for hVIVO's upcoming webinar on the pros and cons of GLP-1 receptor agonists, hosted on pharmaphorum in the spring.